Hi everyone, it's a great pleasure to be here presenting today. My mission for today is to increase the lifespan of each and every single one of you who's sitting here. Thank you. Who's sitting here. Now, you might be wondering how I intend to accomplish that. The answer lies in the power of wearable technology. We all agree that our health is our most precious asset, deserving our utmost attention and care. Yet for too many, access to personal care remain elusive, a distant dream overshadowed by barriers of cost, complexity, and convenience. But what if I told you that personal care doesn't have to be a luxury reserved for a privileged few? What if each and every single one of us had the power to take control of our health destiny whenever, however, and the way we want it to be and we need it the most? It's the promise of wearable devices and remote sensing. My name is Seta Modanloo. I'm a third-year PhD student of psychiatry at the University of Alberta, Canada. Together, let's imagine that this is a regular day. You wake up in the morning, you get ready for work and head out the door. But as the day unfolds, something feels off. Your heart rate is elevated, you remember you didn't have a good sleep last night, and you're wondering what's happening to your health all of a sudden. Imagine if you had a wearable device, and your wearable device could not only detect these subtle changes in your health, like your heart rate, but it could guide you towards the care you need and provide actionable support. It's like having personal healthcare right on your wrist, right? So we are working on a platform that fits well with smartwatches. And our platform, like the Apple Watch, can detect subtle changes like heart rate and activity tracking, but it can go further. We are planning to delve into the realm of mental health, a dimension often overlooked in the realm of wearable devices. Imagine having a companion on your wrist that not only could detect subtle changes like your heart rate, but it could sense your stress level and gives you a heads up when it's unhealthy. So this is how our platform works. While other smartwatches out there, of course, provide valuable data, they often fall short when it comes to interpretation. For example, they don't tell you when it's time for you to see a doctor or when your health needs your urgent attention. That's where we plan to come in. We are working on our platform to work based on a color-coded alert system, like green for optimal health, yellow for caution, and red for urgent attention. So how it works is that whoever who is using Apple Watch, for example, they already grant access to the platform to have their data, right? So people already grant access. What we do is that we send their biomarkers, their health data, to our cloud platform, and we analyze it, and we give it back to the patients in an easy to understandable way, like the color-coded alert system. So our platforms are created based on three most important concepts: management, integration, and sharing. With our management feature, users can manage their own health data within our application, and they can receive easy to understand health data, their health data, and receive updates about their health status. With our integration features, users can receive their health data from multiple platforms like Fitbit, Apple, Google, and Samsung. And with our sharing features, users can securely share their health data with their doctors, with other individuals, and with AI algorithms. And it makes them to be in control of their own health data, and they are who are in charge, and they can decide with who they want to share with, for how long. And they can take it back whenever they want it. It works like your Gmail. You can decide to have a backup and just remove it out of the platform. Google will do it for you, right? So why smartwatches in the first place? What made us think about those? We were working on a project to examining the effect of COVID-19 and pandemic on the both mental and physical health of and productivity, of course, of fly-in and fly-out workers, the workers who work in a remote work locations for a couple of weeks and then they fly back to their home for a short period of time. As we dug into their lives, something really struck us. So we had a mixed method of study design. We had surveys, interviews, and focus groups. As we thematically analyzed interviews and focus groups, we noticed key themes and features. Here are these workers in the pandemic era. They're working so hard, they're stressed out, they're spending most of their time alone in their room. There's no gym to blow off steam, and they feel like they're stuck in their room because going back home means weeks of quarantine, because of course, it's in the middle of pandemic, right? And worst of all, there is no easy access to healthcare. So think about it, these workers are working out there so hard, but when they need to see a doctor, it's a whole ordeal because they only got 1 week off after working for a couple of weeks. And in order to see a doctor during COVID time, they had to stay in quarantine the whole 1 week off they had to be able to see a doctor. So it was impossible for them to see one, right? So these two, reduced access to health support and health degeneration, are the two key points and key themes of our study. There are some quotes that I want to show you. The very first one, our second participant from focus group 1 about not being able to access healthcare services says, during COVID, they shut down physiotherapy because it wasn't essential. Just the availability of medical services was more of a thing, like scheduling things that were a part of a non-essential routine became non-existent. Another participant from focus group 3 about the mental health part of health degeneration says, it was stressful, especially when half the crew goes away and get locked up for COVID, and then still trying to work and get the production done. Another one about the physical part of health degeneration says, I would say for myself, I did get less sleep just because I was doing the testing on the project. We might have to stay up later than normal, but then in the morning, you still had to be back to work. So this is where the light bulb moment happened. What if these workers had verbal devices, the ones that could detect their health data and gives them a heads up when something is wrong and something is not right? I'm talking about a system where if their health data can flag a problem when their health is in a danger zone, let's say it goes red, they could jump on a video call and see a doctor ASAP. And get this, doctors could prioritize the ones who are in the red zone, making sure the ones who need it fast get it first. Now, you might be wondering, why are you listening to this presentation? How does it relate to your personal daily life? Whether you are a busy professional juggling multiple responsibilities or you're a student navigating challenges of academia, this remote sensing can enhance your quality of life in profound ways. And the impact doesn't end there. For people who are dealing with PTSD, for veterans coming back from deployment, and for any other people who are struggling with invisible wound of trauma, these remote sensing project can make a huge difference. Eric talked about stages of PTSD. We could track their health data. We could track their stages with remote sensing. And for these vulnerable population, being able to track their own health data and get updates about their health status is important, and it's a huge win because they feel like they're less alone and they're being monitored. Here's another study we've done, which is under review and has not been published yet, to understand the feasibility characteristics of wrist-worn fitness trackers in health status monitoring. And it's an early experience with Fitbit remote sensing in patient groups. We recruited patients in a rural community who were enrolled in an at-home rehabilitation program for post-COVID conditions. Now, you might be wondering, why are we talking about post-COVID conditions? Because we were talking about fly-in and fly-out workers a few seconds ago. What's the link between these two words? Well, first of all, both these populations are dealing with COVID and has suffered from the COVID effects on their both mental and physical well-being. And most importantly, either they're living in a rural community or working in a remote work locations where accessing to in-person healthcare is almost impossible. So they were asked to wear a Fitbit Charge 2 device, and we had biosensors to analyze. We had heart rate, sleep, and activity. We had surveys, interviews, and biosensors, right? So electronic patient-reported outcome measures for mental biweekly and physical daily were collected using either text or email. It was based on the patient's preference. And exit surveys and interviews evaluated the patient's experience. Here's a glance of our review. We had overall 10 patients, and we observed them for an average of 58 days, and at least half of them were monitored for 8 weeks or more. So all these patients were dealing with COVID, right? So they had moderate to severe level of anxiety, depression, stress, fatigue, and shortness of breath. They were being asked to wear the Fitbit smartwatch almost 20 hours a day, except for the time that they were being charged. And surveys were completed 82% and 78% of the time for physical and mental symptoms. As we saw the results, we noticed that there is a positive correlation between stress and resting heart rate. There's a negative correlation between stress, anxiety, and daily steps, and there's a negative one between sleep time and physical symptoms. Here's a glance of our mental health and physical health data for 2 different patients. And of course, biomarkers, which are heart rate and total steps. So here's our preliminary results. Almost all patients reported an overall positive experience with the Fitbit smartwatch, and this highlighted the potential for monitoring devices to improve safety and access to care for remote communities. The majority of our participants like using the Fitbit system. 86% of them found it easy to learn. No patient found the device interfered with their lifestyle, and only 1 found the device uncomfortable. And there were infrequent concerns about data privacy and security. So in conclusion, we reported excellent feasibility characteristics of wrist-worn fitness trackers and digital symptom surveys in multimodal disease tracking for post-COVID conditions in rural community. So it shows great potential to adapt wearable devices in the medical realm for remote patient monitoring, right? I think it's a huge win. But there are some opportunities and challenges, and there are some questions we need to take into consideration before taking our next steps. What are the best measures? And of course, it depends on what area of mental health we are going to focus on. For example, if we focus on PTSD and depression, what biomarkers, what surveys do we need to focus on? What would be the best measures? And of course, we need to take into consideration that the data we are giving back to patients, they need to be so simple and understandable. Maybe simple charts would be helpful. And we need to take into consideration that how can we access and share appropriate data with healthcare workers for client health management. We need to have the platform and applications to be able to securely exchange data with our doctors. And data standardization is of course important. We need to use the same language, we need to have the same format. And of course, it's important to think about cultural differences. For example, there is a survey, I think it's named Psychosocial Adolescent Inventory, and it's based in USA initially, but there are multiple versions of it for different cultures. Like if you use the USA one for adolescent who has been born and grew up in Middle East, then you would face a huge bias. So these are the most important things that we need to take into consideration. This was my last slide, and together let's seize the opportunity for the potential of remote sensing to increase our not only quality of life, but also our but also our lifespan. Thank you all for listening.